And now we're going to ask Commissioner Hall to come up and talk about how things are going from the county perspective.
Thanks, Kelly. And the title of my remarks, but don't panic, I'm not giving you a long speech. All my notes are on one page. But my title is The Island's Touch. And I will explain when we finish what that is all about. Now, I think most of you know, but just in case anybody was wondering, I am not a healthcare professional. I'm a county commissioner, which means essentially you're jack of all trades and master of none. But I do spend a lot of time with healthcare professionals, and it has been a fascinating journey and a fascinating education these past few years. A lot of people really still, I find, don't know much about what this whole CCO thing is all about. They know it has something to do with healthcare, and even if they understand that it involves the 30% roughly of our population here in Lincoln County who are Oregon Health Plan members, they think, okay, it affects those folks, but if I'm in the 70% who are not OHP, it doesn't affect us, but it does. This is a fundamental transformation in the entire healthcare system based on something called the triple aim: better health, better care at lower costs. Sounds easy, right? No. The Regional Planning Council has been together for 5 years. This was a group of public and private partners who came together: Lincoln, Benton, Lynn counties, Samaritan Health Systems, the Samaritan Health Plans, Cascades West COG, which operates senior and disability services in our region, as well as private providers. And we started talking even before the Oregon legislature had passed the legislation telling us what exactly a CCO would be and how it was supposed to work. We sat down together and started talking, getting to know each other better. Not that we hadn't worked together, but we realized that this was going to be working together in a whole new way. And that's where the island story comes in. Marty Cahill, who used to be in charge up at Samaritan North Lincoln until Dr. Mullins said, "Go east, young man," and he moved over to Lebanon. But when I was kind of having a farewell conversation with Marty, and we were talking about this, and he came up with what I thought was really kind of a great metaphor for what this process is all about. He said, it used to be like we were on our separate islands, drifting through the seas, waving hello to each other, but our islands weren't touching. Now they're starting to touch. Now we are really building bridges that link the islands together. And so the Planning Council was created, it worked together. We essentially established the structure of what the CCO would look like. It came into being August of 2012. And it has been growing steadily, even phenomenally. On January 1st of this year, we went from 8,140, we went to 10,949 members in Lincoln County versus 8,140 in 2013. As of November 1st of this year, we're all the way up to 12,863 CCO members in Lincoln County. So this is directly touching a lot of lives and indirectly touching all the rest of us. You heard Dr. Eby talking about that jam-packed, exciting Community Advisory Committee. Well, that structure came from the Regional Planning Council. And I think both the Regional Planning Council and the Community Advisory Committee have really provided a strong provider voice and a strong consumer member representation and voice. We are successfully meeting all the requirements that the state has laid out for CCOs, including developing a community health improvement plan for the region. So, the island's touch, we're not quite to, if anybody knows history, the great mythical single continent of Pangea when all the land masses came together, but we're headed in that direction, and it's an exciting thing to play a small part in. Thank you.